In today's episode, we are going over lateral versus high ankle sprains. What physical therapists need to know. Let's roll. So, why are we talking about high ankle sprains versus lateral ankle sprains? Well, for one, lateral ankle sprains are super common as a sports injury. In a lot of sports, it's actually the number one injury that you'll see. High ankle sprains are actually a little bit less, but they're still pretty prevalent. Depends on the study that you look at, but around 10, 15% of all ankle sprains are going to be high ankle sprains. And I think one of the problems is that as practitioners, we might not know the differences between the two types of sprain injuries, and they're actually treated a decent amount differently. It's important you know how to diagnose and treat them because they're distinctly different. And I think the other thing, and this is a little bit tough as clinicians, is that for high ankle sprains, there's very little information on how to guide us from an exercise perspective. Most of the research that we're going to talk about today just kind of says you should treat it conservatively and treat it like a lateral ankle sprain. That's only because we don't have good research to show what the best treatments are for high ankle sprains versus a lateral ankle sprains. For myself, I actually just sustained a high ankle sprain. I've had lateral ankle sprains myself in the past. So I've hurt myself with the lateral ankle sprain. More recently, I hurt myself with a high ankle sprain. I've treated a lot of patients with both. And I got to tell you, I think I just got a lot of really good information more recently when I hurt myself with the high ankle sprain, to the point where I think my outcomes would have been much better, right, in the past with prior patients if I knew what I know now. So I just wanted to share this information, right? Lastly, I work at Champion. We work with a lot of students, and I always try to ask as many questions as possible. And it really does seem like high ankle sprains are one of those things like they're mentioned in school, but how to treat them is kind of like up in the air. And there's not a whole lot of distinguishing between lateral and high. And I think there are some pretty good pieces of information I'm going to try to give you today that helps you with the treatment of your patients with these. So, in today's video, we're going to talk about the differences between a high ankle and a lateral ankle sprain. We'll talk about the mechanism of injury, how that's going to be important from a treatment perspective. We'll talk about the prognosis, both in the short and the long term, right? How long does it take to get back from a lateral ankle sprain versus a high ankle sprain? I'll also talk a little bit about diagnosis. So when a patient comes through the door and they said that they just had an ankle sprain injury, how do we diagnose the lateral versus the high, right? What tests do we use, range of motion, all that stuff, swelling. We'll talk about that. And lastly, what are the similarities and differences with treatment, right? Because, there should be a difference in treatment for a different type of injury. Can we treat them exactly the same? Should there be some nuances? We'll talk about that. We'll discuss that a little bit. Okay. Now, before we get going, I actually made a really nice cheat sheet for you. It's an evidence-based guide to ankle sprain injuries, a cheat sheet. Put a link in the bio. If you want to check it out right now, if you're on Instagram Live, you can go to my profile under highlights and foot and ankle. You can download it right there, 100% free. I go over prevalence, history, and clinical presentation of these, prognosis and natural history, predisposing factors, risk factors for injury. I go over the mechanisms of injury, anatomy, diagnosis, differential diagnosis, right? Making sure you don't have a fracture in your ankle before you start treating these folks. Treatment ideas, return to sport and work, as well as injury prevention. So go ahead and download that. It's 100% free. Let's get on to today's topic. So let's go over a little bit of anatomy of high ankle versus lateral ankle sprains. I have a foot and ankle right here. I'm going to do my best to try to show you what's going on here. So this is the inside of the foot and ankle, and this is the outside of the foot and ankle right here. When I have an injury to a lateral ankle sprain, it's obviously on the outside, the lateral side of the ankle. And the ligaments are usually involved. They're going to be ATFL. So this is the distal part of my fibula, my lateral malleolus. So anteriorly, right, in this area here would be your ATFL. And then more posteriorly, directly on the side of the ankle, you'll find your CFL, right, here. And that's an injury right to this area, okay? And the other thing about having a lateral ankle injury is there's often going to be some sort of osteochondral injury associated with that. That just means there's some sort of injury to the bone or to the cartilage. And that's in around 7% of these folks. So diagnostically, it's tough to tell who has these, but just keep in mind that sometimes these folks don't have just a ligament injury. Sometimes they have a fracture right? Which you rule out with the auto ankle rules. And they may have some sort of osteochondral injury, right? Which after you try to treat this conservatively, if things aren't progressing well, maybe refer out to the doctor to try to figure out next steps, okay? Now, if someone presents with a high ankle sprain, the high ankle sprain is just named because the pain is not on the outside like the lateral ankle sprain. It's much higher. Apologize if you guys can't hear me well. I know I'm blocking my voice right now, but the injury is going to be much higher. So the space between my fibula and tibia, you have a few ligaments right here. They are the syndesmotic ligaments. And this is where one of these injuries occurs, right? So the thing is, when folks have a high ankle sprain, their pain is higher, right? And it's usually right between these areas and sometimes it extends up a little bit through here. That's why they label that a high ankle sprain versus a lateral ankle sprain where the pain is more on the outside of the ankle, right? So there you have it right there. Let me put this down and we'll get moving on. So in terms of the mechanisms of injury, when a patient comes in, if they just had a lateral ankle sprain, they usually are going to report some sort of rolling injury, right? So they rolled their ankle or they inverted their ankle, okay? So again, I'll bring up this clunky model just to show you, but when someone has an inversion injury, usually they're doing some sort of sport and then they land on the outside of their foot and they roll it in, okay? They invert the ankle. They have a rolling mechanism of injury, okay? And the most common sports you'll see this is going to be sports that require a lot of jumping, cutting, pivoting, sports like basketball and volleyball. And the lateral ankle sprains are usually non-contact in nature, okay? If you contrast this to a high ankle sprain, this is usually a twisting-based injury. So oftentimes your patient will come in and say they twisted their ankle as opposed to rolled it. Do keep in mind though, and this happened to me recently, I hurt my ankle and I couldn't tell you what the heck happened. Okay. I recreationally do Brazilian Jiu-Jitsu. I was doing a takedown. I fell to the floor. I felt kind of a pop in the front part of my ankle. I actually didn't think much of it. Didn't know what had actually happened. I thought I kind of banged the front of my ankle on someone's knee. I know that sounds crazy. That's what I thought happened. And then, a day or two later, after I did some evaluations, like I got a high ankle sprain is what ended up happening. I probably twisted my foot on the way down, although at the time I didn't really recall what happened. And I find that happens with a lot of individuals. They don't really remember exactly how it happened. Some do, but oftentimes you have to do some guesswork to try to figure that out, okay? So usually this is going to be an external rotation injury. So basically if someone's foot is caught and twists outward, okay? That's usually the mechanism for these folks. The other thing to keep in mind is that these are often contact injuries, and the sports where this occurs most are contact sports. So you see these most with things like wrestling, things like football, things like ice hockey. Ice hockey is actually one of the highest rates of high ankle sprains of any sport, which I found interesting because these folks have boots on and you would think that they're more or less protected, but that's not the case. These guys actually sustain quite a bit. Okay. Moving on. What are the prognosis of these injuries? I have done a lot of work on the lateral ankle sprain. I'm releasing those episodes right now. You guys can listen to that if you'd like. Head over to my YouTube. You can check them out. My website, it's all up there. It's crazy. Lateral ankle sprains, it's very interesting to me. So the large majority of these are going to resolve within around 2 weeks. They have a return to play rate. And again, it depends on the sport, depends on the study that you read. Around 50% of these folks are returning within 24 hours, right? Some studies show that the average return to sport time for a lateral ankle sprain is 1.4 days. Okay. And this is crazy to me. And it's funny because the last time I had a lateral ankle sprain myself in high school, what did I do? I went to a wrestling camp the next day. So got myself a beefy lateral ankle sprain playing football. Next day, I went to a wrestling camp and wrestled the entire week. And my ankle was just blown up like a balloon and it hurt, but I just kind of played through it. And I think that's what the majority of folks end up doing, unless they have a very, very severe ankle sprain, they often just play through it. And we know that's a problem because around 50% of folks have a lateral ankle sprain. Again, depends on the study you look at, are going to have either recurrences or some sort of chronic issue with pain, stiffness, sensations of instability, all the like. So these tend to get better very, very quickly, right? A large majority of people do not seek care. They don't get good care whatsoever, and then they have long-standing issues, right? The recurrence rate is crazy. Now, in terms of the high ankle sprain, I'm going to say this stat before I go to the next slide. The average return to sport time, and again, this really depends on the study. We'll get into the nitty-gritty of this, is around 40 to 45 days to return back to sport. So if you look at the return to sport of lateral ankle sprain, 1.4 days, to high ankle sprains, 41 to 45 days, very big difference in return to sport times. So if you have an athlete that suffers a high ankle sprain injury and they're in the middle of a sports season, you can actually give some decent information about planning for this. Okay. If it's a lateral ankle sprain, probably don't want to do this, but you can probably play through it a little bit more so. Okay. Get back to playing more quickly. If it's a high ankle sprain, we have to think a little bit differently. Probably you're going to have to hold back a little bit more so in these folks. And that's going to make up some of our reasoning from a treatment perspective we'll talk about in a bit. Okay. So some more prognosis for high ankle sprain injuries. In NCAA athletes with high ankle sprains, 69% of injuries resulted in greater than 1 day of participation restriction. So 70% or so had to restrict for at least 1 day. Around 47%, so half of those are going to have to restrict for at least 7 days. And then 15.8% restricted for more than 21 days for sports participation. Now, I think that this is going to vary a lot based on the sport. So when I had my high ankle sprain, it's been about 6 or 7 weeks so far, I deadlifted, I want to say 3 days after I had the injury. And then I squatted heavy 7 days afterwards. And if I was into just strictly weightlifting as kind of a sport participation thing, I would have returned to sport very, very quickly. You have a rowing athlete, NCAA rowing athlete, if they have a high ankle sprain, I bet you they're getting back to rowing in a couple of days. Okay. But if you have to return to something that requires a lot of jumping, cutting, pivoting, changing direction, it probably changes quite a bit. This was a cool study. This is an NFL athletes, and the average return to play time was actually 11 weeks, which I think is realistic for a sport, like I said, that requires a ton of sprinting, cutting, jumping, changing direction. So if you have an athlete that's getting back to something that doesn't really require a ton of stability at the foot and ankle, sport-wise, they're going to get back faster. However, if you have someone that has to get back to a lot of activity that really demands a lot of strength, stability, and all the like of the foot and ankle, it's going to take longer. Okay. So closer to that 11-week mark might be reasonable. And keep in mind, these are NFL athletes. These are folks that are doing rehab 2-3 times a day. Their whole likelihood depends on rehabbing this. So they're probably doing a decent job from a rehab perspective, and it still takes them 11 weeks to get back. Okay. So the high ankle sprain needs to be respected as a pathology. How about diagnosis of the lateral ankle sprain versus the high ankle sprain? Now, I have a lot of diagnostic videos for high ankle sprains and lateral ankle sprains. If you go on YouTube and check it out, if you're watching the recorded version of this, I'll put this in the show notes so you can check that out. I'm going to try to describe these tests as best I can, but if you want to see me performing them and also doing all the palpation on a real human being, I have those, so you can check those out. So when you have someone that has a lateral ankle sprain, these guys tend to swell quite a bit. Okay. So you'll notice, let's say it's an equal grade injury of a lateral ankle sprain versus a high ankle sprain. The lateral ankle sprain tends to swell more, and you see a lot of swelling on the outside of the ankle. Okay. Very common. The other piece is that in a lateral ankle sprain, once you start palpating the lateral ligaments, they're usually tender. So the ATFL, if you start palpating the lateral malleolus and you start going a little bit more anteriorly, inferiorly, palpate where the ATFL connects, usually pretty tender. Okay. You can also palpate the CFL. And if that's involved, usually pretty tender. If you contrast this to a high ankle sprain, those ligaments are usually not going to be that tender. Although sometimes you injure all the ligaments, right? That certainly can happen. If it's an isolated high ankle sprain, you probably don't have tenderness palpation of the ATFL or CFL. If you start palpating between the distal tibia and fibula, where those syndesmotic ligaments lie, you'll notice some tenderness there. And that helps you to rule in more of the high ankle sprain versus the lateral ankle sprain. The other piece is that in a high ankle sprain, you usually have a mechanism of injury of external rotation, right? So when you're doing your assessment with someone you suspect has an ankle sprain injury, if you invert the ankle and that produces a lot of pain, you might start thinking lateral ankle sprain versus externally rotating, dorsiflexion, externally rotating. If that provokes patient's symptoms, especially in the high ankle sprain area, you start to rule in more of a high ankle sprain injury. You can also try a squeeze test. So essentially, if you take your hands, run them up your patient's calf and squeeze together, squeezing the tibia and the fibula together, what that does is it gaps the distal segments of the tibia and fibula, stretches the syndesmotic ligaments. And if that's positive, that kind of helps you rule in more of a high ankle sprain. Okay. The other piece is that if you have A lateral ankle sprain, even if it is a grade 2, grade 3, so a ton of swelling, looks terrible, right? Tons of bruising, lots of pain, can't walk too well on it. As long as you have a negative Ottawa ankle rules, so basically not having any tender palpation of the fifth met head, navicular, the posterior tip of the medial and lateral malleolus, and you can walk more than 4 steps, then you probably don't have an injury of the bone, right? Or at least a fracture. You can actually have an injury to the bone, and you don't need to send them back to the surgeon. Okay. You can start trialing conservative care. And if things aren't going well, you can always send to the surgeon at that point. With a high ankle sprain injury, and again, we don't know the best management of these things yet, right? But if you look in our medical literature, a lot of the papers will recommend if you have a grade 2 or grade 3 injury, they may want you to go and get surgery in order to help this get better over the course of time, right? If you look at papers looking at return to sport after syndesmotic ligament injuries, if they're comparing surgical versus conservative approaches, they both seem to do decently well. And the return to sport times are going to be a little bit longer for the surgical management versus the more conservative management. And historically, from a lateral ankle sprain perspective, back in the day when folks had a lateral ankle sprain, docs were a little bit faster to recommend surgery. And the reason being is because we didn't know at that point that these folks tend to get better pretty well if we just are really good from a physical therapy perspective. They may not need surgery. So historically, we used to do more surgeries for lateral ankle sprains. And over the course of time, we started doing less and less and less and reserving surgery for folks that don't do well conservatively. Currently, in our medical literature, it seems like we're a little bit more aggressive with referring patients to the surgeon for high ankle sprains. But my gut kind of tells me that over the course of time, we'll probably find that more folks do well conservatively. We might not have to jump the gun quite as much with surgery in these folks. However, if you have a really bad high ankle sprain injury on your hands, at least for me as a physical therapist, I usually refer out to a trusted surgeon more quickly, as compared to a lateral ankle sprain, where I'll usually wait longer until the patient's not making progress. Okay. So high ankle sprains, maybe think to send out to a surgeon a little bit quicker with grade 2, grade 3. Lateral ankle sprains, probably not. Get started with physical therapy right away, as long as you don't have any fractures present. Okay. So let's talk a little about treatment here. I want to talk about the key points. And I already said this, but there's very little literature guiding us in terms of what's best from an exercise perspective for high ankle sprains. But there is a ton of literature to help guide us from a lateral ankle sprain perspective. And if you look at the studies that are trying to guess what's best for treatment from an exercise perspective for high ankle sprains, they say to treat it similarly to a lateral ankle sprain. Okay. So that's largely what I do, but I have found that there are a few nuances between the two that help me with my treatment over the course of time. Okay. So a couple key points. When someone presents with a lateral ankle sprain, we can probably go faster. We know early motion is going to be good with these folks. As long as they don't have a fracture, we can get them going right away. If we need to immobilize them, and we'd rather not if we don't have to, it's a very short period of time, and I'm less likely to try to immobilize a lateral ankle sprain compared to a high ankle sprain. Okay. In terms of return to sport times, we know that folks get back much more quickly. I'll also say that I don't think we do a good job of return to sport testing for these folks. But if you're going to return to sport test a high ankle sprain versus a lateral ankle sprain, I think the lateral ankle sprains are probably going to get better a little bit faster than the high ankles. Let's contrast this with a high ankle sprain. So, broad strokes, high ankle sprains probably need to go a little bit slower. They seem not to heal quite as well. Okay. The other piece is I may be a little more likely to try some immobilization with these folks. There's a bit of research that shows that if you immobilize these folks for less than 10 days, they tend to do a little bit better than if you don't. I think the problem is that this research is in lateral ankle sprains. We don't know if that's a case for high ankles. I'd love to see some more research about that. And my gut tells me that we should probably try to immobilize these guys as little as needed. So if you need to immobilize them for a very short, very brief period of time, go for it. But we probably want to get these guys started with exercise as soon as possible as well. Okay. I already mentioned this, but we probably are going to have to go a little more slowly with our rehab. And what that means is that the return to sport time is going to be a little bit more delayed. We know that's a case in the medical literature right now, and it's actually very, very different from a lateral ankle to a high ankle. Okay. So these need to be respected. They take a little bit longer, up to 11 weeks in professional football players. And these guys are getting hopefully the creme of the creme, the cream of the crop, PT care, rehab care, right? So what are the key points for exercise for both lateral ankle sprains as well as high ankle sprains? Okay. Now, we have a lot of research about lateral ankle sprains, but we really don't know the best dosages, best exercises, best intensities to treat these. Okay. We wish we did, right? But we don't have the information quite yet. However, some key points are that you probably want to initiate physical therapy as soon as possible for both of these conditions. Okay. The longer you're not doing your fitness, right, the more unhealthy you get, the longer it's going to take you to build back all those attributes from a fitness perspective that get you back to sport and get you back to your activities. So if we can start earlier, I'd rather do that. I don't want to lose a ton of muscle mass, wait for weeks and weeks, and then try to rebuild that over the course of time. Okay. We know that's worse. If you look at the research, you mobilize someone's ankle for 4 to 6 weeks after a sprain injury, they have a worse outcome. Okay. We want to get these guys going as soon as we possibly can, just making sure you're not exercising through a fracture. Okay, that's important. I know I said that several times, but again, can't mention that enough. We also want to try to restore range of motion, strength, balance, proprioception, and also return to sport. Okay, we'll go over these a little bit more in depth. What I will say is that I already have an evidence-based guide to lateral ankle sprains that's being released right now, where I go over the treatments and everything else a bit more in depth. So you guys are welcome to check that out. The other piece is that I'm going to do a case study for high ankle sprains and a case study for lateral ankle sprains. So if you want to see exactly how I go about treating these things, you can check that out. This video is more about the differences between the two and some clinical reasoning you can take away to help with your patients, right? Now, from a range of motion perspective, this is one of the things that's on my mind that I'm not sure how to best approach it, but do keep in mind, after you've had a sprain injury, you have just damaged a ligament, and sometimes you completely rupture it, okay? Now, when you completely rupture a ligament, you actually gain range of motion, right? So when we have a shoulder dislocation, as an example, we're very cautious to avoid some of those end ranges because we're fearful of redislocating that shoulder, especially early on after you have that injury. And over the course of time, we obviously need to restore that range of motion. Now, the ankle is interesting because for whatever reason, it tends to stiffen up in some ways. In other ways, it tends to get a little bit looser. It's a little similar to how the elbow behaves after a dislocation. So after you dislocate your elbow, it has a tendency to just get stiff. So we actually want to do a lot of mobility after you've had a dislocation. Now for the ankle, we tend to lose range of motion into dorsiflexion. If you've had a lateral ankle sprain, you actually may end up gaining more inversion range of motion because you stretch the crap out of those lateral ankle ligaments. However, as the ankle starts to scar down and heal, some of that scar and the synovium actually gets stuck in the front of the joint. And you actually have changes to the bone in the front of the ankle that can lead to anterior impingement and reduced dorsiflexion range of motion. Okay. So it's crucial to restore dorsiflexion range of motion after these sprain injuries, particularly in lateral ankle sprain injuries. However, if you have a major ligament injury, we probably don't want to stretch the joint too aggressively early on, right? Because you got to let that heal. You have to let that scar down a little bit. So my recommendation is that for the first 1 or 2 weeks after you had an ankle injury, particularly with the high ankle, because we need to go a little slower here, I actually want that to stiffen up slightly, okay? So when I do mobility, and I do recommend doing, mobility drills right after you've injured yourself, I just wouldn't push it extremely into end range, right? And the way you can tell if you're going too far is to just look side to side, right? As long as the other ankle isn't screwed up compared to the one you just hurt, right? From an old injury or for whatever reason, try to restore symmetry between sides, but don't go beyond that. The other piece is you're not trying to blow through a whole bunch of pain when you're doing this. I tell my patients to push to the point where you feel that discomfort and then pull back again, right? And my earliest emphasis early on after injury is try to restore the dorsiflexion range of motion, but we also want that plantar flexion, inversion, eversion back if we're losing that as well. So I think it's important you evaluate all the range of motions. Just make sure you have a well-rounded program to restore mobility, but don't go nuts so early on. This was kind of an interesting anecdote from my high ankle sprain, but when I sprained my ankle recently, that was about 6 or 7 weeks ago, when I tried to dorsiflex on the injured side immediately after the injury, I actually had more range of motion than I did before, okay? So when we dorsiflex, one of the things that happens is the tibia and the fibula get spread apart because the talus wedges underneath the two bones. And because we have a syndesmotic ligament or a series of them, they end up reducing the amount of separation between the tibia and fibula that the talus causes end range dorsiflexion. If you lose those ligaments, you try to dorsiflex, what happens is the tibia and the fibula, they can separate, and now you can actually dorsiflex a little bit further. So it was a little bit creepy. I felt like I had way too much dorsiflexion right after the injury, and that freaked me out. And one of the things I did for the first 2 weeks is I reduced my range of motion because I didn't want to separate my distal tibia and fibula. I wanted to allow those to stay together. So over the course of time, the ligaments would scar down, heal. And interestingly to me, around week 2, I got extremely stiff. If you look at some of the ligament healing research, obviously there's different ligaments around the body, but around 2 weeks, we're starting to build some scar in that area. So what I started to do is I really ramped up my mobility at that point. So around the 2-week mark, when I started to feel stiffer and stiffer, I just started to really hit it from a mobility perspective. Okay. All right. Sorry. That was a lot. That was a big aside there. Okay. In terms of other treatments, we probably want to focus maybe a little bit on manual therapies. There's a really good study by Cleveland et al. I plan on making a video of these manual exercises, but what they did was, and this was lateral ankle sprain, so maybe a different beast for high ankles. They took folks with a lateral ankle sprain, and one group received exercise, and the other group received exercise and manual therapy. The manual therapy group had a better long-term outcome, which is important because usually manual therapies are better in the short term, but long-term doesn't matter. For this study by Cleveland et al., it actually was better. So might be a useful treatment early on. How about bracing? Bracing is another pretty common treatment you'll see for lateral ankle sprains. And the research seems pretty clear. It seems to be beneficial for folks after they've had a lateral ankle sprain in 2 instances. So A, it actually helps to prevent injuries in folks that haven't had an ankle sprain yet. Second piece is that after you've had an injury, if you wear an ASO while you play, even after the ankle has healed, it reduces recurrence rates. Okay. The other thing is that if you wear it after you've had an ankle sprain injury, it can help to improve your outcome. So speed things along a little bit. Maybe helps to protect that range of motion early on, allowing you to do a bit more activity so you heal a little bit faster. Okay. One thing to keep in mind about ASOs, so like a lace-up brace for the ankle, is that they tend to reduce range of motion. I put one of these on recently because of my ankle, and it does. It doesn't allow you to dorsiflex or plantar flex as much. And if you take athletes and put them in an ASO and test their long jump, vertical jump, it reduces their performance a little bit. So it reduces range of motion, reduces performance. So, it may be something to utilize in your athletes more long-term, but at least in my mind, let's get them back to the point where their ankle does its job. We don't reduce their performance by wearing these long-term, right? I did a lit review. I'm like an hour and a half late to doing this live stream today. And one of the major reasons was I was trying to find some more research to guide treatment for high ankle sprains from a functional bracing perspective. So the majority of research I looked at recommends using like a lace-up brace for ankle sprain patients. However, that's in lateral ankle sprain patients. It's not in high ankles, right? The other piece is if you look at a lace-up brace, an ASO, it's really good at reducing medial to lateral motion or motion in the frontal plane, okay? It also reduces a little bit of dorsiflexion and plantar flexion. If you have a lateral ankle sprain, oftentimes we can't control motion in the frontal plane well. In a high ankle sprain, we can't control motion in the transverse plane. We can't control twisting very well. ASOs weren't designed to reduce twisting as much. So what I found is that the ASO hurt me, A, because when I put it on, it was pressing right on my high ankle sprain area and just felt god awful when I walked. And B, it didn't control rotation at all. So despite it being rigid and reducing motion in a lot of directions, it wasn't really reducing motion in the transverse plane, which is what I actually felt was lacking. So personal anecdote for high ankle sprains, maybe not as helpful for the as opposed to a lateral ankle sprain, but that's just been my experience. Boom. So how about treatment goals? Okay, we talked a little bit about the differences between the two, some of the similarities between the two. What are you aiming to do for these athletes before you throw them back to their activities of their sport, right? So A, we're trying to restore range of motion. So whatever you got to do to get that range of motion back, and go for it. We're trying to reduce the swelling. We're trying to reduce pain. So you can use all your modalities or whatever strategy you want to try to do that. We're also trying to restore strength. So at the very least, trying to restore plantar flexor strength, but also probably testing inversion, eversion isometrically. If you can, resisted dorsiflexion. These are hard motions to test. I know that. I've tried this a bunch of times. It never seems like I do a really good job despite how much creativity I try. But you probably want to try to measure those before you return back to sport and get at least 90 to 100% there, right? We're also trying to restore neuromuscular control or balance. So essentially, can you balance the same side to side? Let's say eyes closed and eyes open, 30 to 60 seconds. You can also utilize, let's say, a SAR excursion balance test or a Y balance test to assess your progress over the course of time. Now, obviously, you can use a ton of balance exercise to restore this over the course of time as well. The other goal is you're trying to match the sport demands, right? So if you're trying to get an athlete back to, let's say, soccer, we need to make sure that in the PT clinic, we're doing change of direction drills. We're doing kicking. We're trying to do some sort of sprinting. We're doing, let's say, agility work, right? We're trying to match the conditioning demands the athlete has to experience in the next few weeks when they transition back to training, right? Back to participation, whatever activity they're involved in, okay? And the last piece you're trying to restore is psychological readiness. So largely, we want to make sure that our ankle patients feel like they're actually ready to return back to sport. And we haven't just passed a bunch of, let's say, objective measures that look good, but the athlete just doesn't feel like they're ready, all right? Usually the two are related. So if you do a really good job with your PT, right, usually they feel like they're ready to return to sport, okay? But that's something to keep in mind. So how about treatment of lateral ankle sprains versus high ankle sprains? Well, I think the biggest takeaway I've gotten recently from hurting my ankle, having a high ankle sprain, is that in a lateral ankle sprain, we can't control motion in the frontal plane. Okay. So if I just rolled my ankle, so think about it, I roll my ankle this way, I stretch everything on the outside of my ankle, I can't do side to side stuff very well. Okay. So probably because your body just had the peroneal stretched aggressively, ATFL, CFL stretched aggressively. Your proprioception is going to be diminished. The firing time of the peroneals might be delayed because you stretch the crap out of the peroneal nerve, right? And I can't control motion in the frontal plane very well at all, okay? So early on, we probably want to protect this a little bit. Let's make sure we don't go too aggressively side to side because we might roll that ankle again, okay? If you contrast this to a high ankle sprain, in a high ankle sprain, you haven't injured the outside of the ankle, okay? So it's not like you rolled your ankle straight to the side and everything on the side of the ankle is damaged. Damage is in the front of the ankle. And what happens is you lack the ability to control rotation early on. Although frontal plane stability is still there, those ligaments weren't damaged. So that side-to-side control might actually be pretty decent in a high ankle sprain. What might not be decent is rotation, okay? So one of the things that happened to me is I rolled my ankle on a Wednesday. I came to work on a Thursday, and I remember limping throughout the day and grabbing a med ball to show my athletes how to do a shot put toss. I have to rotate on that injured ankle. I had zero stability there. If you asked me to walk forward and turn to the side, I felt like I would start to turn and then fall over. I literally had zero control in rotation, okay? So early on, I had to be very cautious with rotating with these folks, okay? So early on, after you have a high ankle sprain, you have to be careful with rotation to control rotation. Lateral ankle sprain is the opposite. You need to be able to control frontal plane motion, side to side motions, okay? Don't do too much. Let that heal a little bit. Then when it comes to lateral ankle sprains towards the end stage of rehab, we are trying our darndest to get better at frontal plane stability, right? So we stretch the crap out of those ligaments. Hopefully they scar down a little bit, and we have to restore the ability of the ankle to move side to side, okay? So what becomes important? Well, from a strength perspective, we have to get really good at resisted pronation, resisted supination, and resisted eversion, especially because those peroneals might be shut down due to the nature of the injury, okay? From a balance perspective, we're probably going to focus on unstable surfaces. If you're going to be using a rocker board, so standing on a rocker board that gives you some instability, you probably want to place that in a way where you have to control the frontal plane or side to side or lateral stability. From a change of direction or sport-specific perspective, we have to get really good at moving laterally. So things like shuffling are going to be very, very important just because there's so much demand in that frontal plane, and that's exactly what you lose after you've had a lateral ankle sprain injury, okay? So how about a high ankle sprain? So we said this already, but after a high ankle sprain, we lack the ability to control rotation, and now we have to restore that control, okay? From a strength perspective, all the same stuff is going to be important. However, we have to get really good at controlling rotation, okay? So what that means is that the resisted eversion and inversion that you typically do with an ankle sprain injury is still important. However, you can get a little bit more creative by trying to control rotation. So I do a bunch of drills with my ankle sprain injuries that are going to improve the ability to rotate at the foot and ankle. And those drills are interesting. I have a bunch of them posted up on YouTube. I'll put some of the links in the show notes so you guys can check it out. But largely, I do closed chain, tibial rotation, or resisted supination, pronation, inversion, eversion, whatever you want to call it. But as opposed to taking the band and putting it around the front of the foot and then doing your resisted eversion, inversion, you actually put the band around the heel, fix the foot to the ground, the front of the foot, and then go into tibial internal rotation and external rotation. And what we're doing is we're trying to control motion better at the foot and ankle. We're probably getting some of that motion coming upwards, up the stream at the knee, probably some control coming from the hamstrings, but that's okay. We want to make sure all those players are on board, but we get a little bit more creative with our strengthening because we know rotation is actually the thing we have to restore. Okay. The other piece that I do a lot of in these patients is introducing more rotation strengthening exercises. So that's as simple as, let's say, doing a chop exercise. So taking a cable, setting it up around shoulder width, and then grabbing onto a handle and turning and rotating side to side, improving some stability without that foot. You can do that on one leg as well. So we can do like a single-legged balance with an anti-rotation press. So as you press out, the band is trying to turn you and rotate you, and using your hip, your ankle, your knee to stabilize rotation. Okay. From a power perspective, I like to start doing some jumping with turns. Okay. So for my lateral ankle sprains, maybe I'm doing some lateral jumping through a ladder and prioritizing that. For my high ankle sprains, I'm prioritizing a jump with a turn. So a jump with a quarter turn. So when you land, you have to control all the rotation that's trying to occur within your foot and ankle. And then from a power perspective, we have to restore the ability to throw, right? So if you have a baseball athlete, if you're dealing with some sort of athlete that requires a lot of rotation as part of their sport, we have to do things like shot put pulses. We need to do things that require a lot of power production for the lower extremity up to the upper extremity. And that just needs to be a part of your rehab. Okay. From a balance perspective, we already hit on this a little bit, but we're focusing on rotation, anti-rotation. So balancing on one foot, anti-rotation presses are really good. I love bouncing on one leg and dribbling the ball against the wall, side to side, challenging rotation as best you can with your patients. From a sport-specific perspective, we're probably focusing on pivoting, rotating, and turning. So any change of direction drills that utilize a lot of, pivoting, turning, cutting are going to be really important because they are going to challenge rotation of the ankle. Okay. All right. So that's pretty much it for today's lesson. I do want to let you guys know again, one more time before we kind of wrap up and take questions about this evidence-based guide to ankle sprain injuries. I'm really bad at saying evidence today. I'm saying evidence. I'm like a 2-year-old. Apologies. So I'll put that link in the show notes. If you guys want to check it out right now, it's a free download. You can head to my Instagram and go into the highlights section under foot and ankle. It's right there. You just have to sign up for it. But anyway, we go over the prevalence of these things. We go over the clinical presentation, natural history, prognosis, risk factors, and mechanisms of injury, anatomy, differential diagnosis, treatments, return to sport and work, injury prevention, all really in depth. So I definitely recommend checking that out. Again, 100% free. If you guys want to see the references, I know you can't see them right now. If you're watching this on YouTube, the font is teeny tiny and there's a lot of references, but I'll leave that in the show notes as well. So if you want to check this out after the recording, it'll be there on my website and also on YouTube. Okay. So before we wrap up, I just wanted to ask if anyone has any questions. Before we do that, I just want to thank you. Always appreciate you guys for coming on here and watching. Looks like the Instagram live has been growing over the course of time. That's awesome. I love it. Appreciate you guys watching. That means the world to me. If you guys have any questions, you can always leave them in the comments, right? And I'll answer them later. If you have any questions right now, leave it in the comments of either YouTube, Facebook, or on Instagram. And I'm going to look at my phone right now and take a look, and then I'll try to answer these. Veronica, thank you for this info. My son has a lateral sprain and we'll make sure he does his exercises now. That's always great. Thanks, Veronica. Hopefully that does help out a little bit. So here we go. All right. Here we are. Looks like the Coach Kai SPH. Will this be available to rewatch? It will. So it will be saved on my Instagram, on our Instagram lives, but it's also going to be up on my website and on YouTube. So if you haven't already checked out my YouTube channel, definitely do that. I've got all of the same content mostly on Instagram and more. I go crazy on YouTube. I put up a crazy amount of information. So I definitely check that out. All right, scrolling up. Let's see what we got. Pretty busy day. Awesome. All right. Scrolling. Cool. Boom. Boom. And storm 4. My son is a football player and had a high ankle sprain. He is completely recovered and went through therapy. What can be done to reduce the chance of that happening again? That's a good question. I think for one, all of the things that were important from a rehab perspective are going to be important long term. So I think it's probably important that you make sure you restored his range of motion. So left to right, range of motion should be the same as best you can. Should be minimal to no pain. Hopefully there's no swelling in that area. A lot of that is managed by the amount of activity that you do. So for these folks, from a rehab perspective, and also in the future, if they have a really bad ankle injury, especially if a recurrent one, you may notice that if you overdo it, it gets more painful, it gets more swollen, it gets more irritated. So things like the acute to chronic workload ratio become very important, which essentially means that, let's say your son is starting up a given sport, usually at the beginning of a season. The coaches love to hammer kids with conditioning, right, in the preseason. And sometimes that can lead to some problems. So just make sure he has a little bit of fitness going into the season and make sure they're not overdoing it from a training perspective, right? You want to make sure that you have restored your son's balance within the ankle. You can check out the Y balance test or the star excursion balance test. I plan on making a video about the star excursion balance test so you guys can see exactly what it is and see if you've restored someone's balance over the course of time. All right, definitely recommend that. You want to check the strength side to side. Does your son have good, can you do the same amount of calf raises on the left side versus the right side? Can you do the same amount of back to wall tib raises side to side? Has he restored his symmetry, right? I think that psychological readiness is also important. I can leave a link in the show notes for that, but it's just an outcome measure to see if he feels like he's ready to return back, because that'll kind of help you determine whether or not he feels like he is fully recovered. And then maintaining some sort of strength in the ankle, some sort of balance in the ankle. So 1 to 2 times a week, performing some basic lower leg strengthening, I think is important. So calf raises, tib raises, and also incorporating some single-legged balance exercises into his regular routine, and potentially thinking about putting some of that into a warm-up. There's several warm-up programs out there, particularly in basketball players, that folks go through prior to their games, right, or training. And it seems like those drills, which are going to be a variety of different strengthening, stretching, balance exercises, seem to reduce the likelihood of new injuries in the future, okay? So I know that was a long answer. Apologize. Hopefully that answered your question. All right. Moving along. Yeah, and I think the last one here is just Coach KYSPH. Will this be available to rewatch? Yes, it will. Yes, sir. So on YouTube, it's going to be available immediately. And then I'm actually going to take this video and edit it, chop it up a little bit, and put it on my website as well. So definitely check that out. I'm also releasing a ton of ankle sprain content in the next probably 8 weeks or so. Just keep your eyes peeled on the channel, this as well as YouTube, my website. And that's it. Okay. Thanks again, guys. Appreciate you joining me today. And I won't be in next week. I got some friends going to be in for the weekend, so I won't be here next Friday, but I'll see you on the following Friday. Okay. Thank you, guys. See you on the next one.